Hello, welcome to the Safety Advocacy podcast. My name is Barakat, and today we're going to be talking about first aid. In this day and age, first aid, you'll not agree with me that first aid is as a topic cannot be overemphasized, because everywhere we go, we see people committing blunders. We see deaths that could have been avoided if only the people around the casualty had adequate knowledge, in fact, basic knowledge of first aid. When we talk about first aid and the blunders and all of that, one thing that readily comes to mind is the recent occurrence at the National Assembly, where the NDDC chairman collapsed, and the people around him were all scrambling and not knowing what to do. And even the person that was bold enough to go close to him committed a very huge blunder that didn't go unnoticed by the general public. So to take care of the topic, to do justice to the topic, I have with me here today a leader, a mentor, and one of the people I look up to in the area of emergency response, first aid, and CPR. We have here Mr. Dare Akinfosile. He's going to be talking to us about first aid with practical examples and do's and don'ts. At the end of this whole session, we expect that at least you have basic knowledge of first aid to be able to save a life whenever there's the need or whenever you have a casualty around you. You're welcome, Mr. Dare.
Thank you. Thanks for having me. Thanks.
Yeah, you're welcome. So let's use the issue on ground as the issue I talked about earlier as the starting point. What do you think could have been done better? How do you think we could prevent occurrence of such blunders in future?
Yeah, as much as that seems funny, it was actually disgraceful because that shows the level of importance we've attached to first aid, even at that level. In that kind of environment, you would expect to have trained personnel, paramedics, even doctors or on-site nurses or healthcare workers. Mm-hmm. Yes, it could take some time before a doctor or a paramedic would arrive at the scene of an incident.
Yeah.
And so even at that, but that window or that event also showed that people, even at that level, do not understand the basics of first aid. Their approach was quite wrong and was quite shameful. Although one might want to say that in the heat of responding, adrenaline, it's also a function of preparedness. If you are well prepared, you would overcome anxiety, you would overcome... It just shows lack of knowledge. Mm-hmm. And that shouldn't have occurred. What should they have done is to assess the situation, approach the person, and particularly because it was in a pandemic. I remember someone forcing the victim's mouth open, blowing into the air. No, it doesn't work that way. Even if it was a case of cardiac arrest, that wouldn't have worked. Okay, so there was a need. The need would have been to assess the person's breathing. If the person is breathing, are they responding? And if they are not breathing, you're supposed to bring them onto the floor and start what we call cardiopulmonary resuscitation, where you put two arms on the chest while leaning along the casualty, compressing the chest 30 times, and ventilating. Ventilating is when you do mouth to mouth. But because in light of COVID, the guidelines have been tweaked a little to discourage responders from doing mouth to mouth or mouth to nose, as the case may be, except if you, for instance, a caregiver or you are a mother and your child is in cardiac arrest. You would have to perform CPR, performing the 30 chest compression and to rescue breath. It's something we cannot demonstrate, but it's as simple as that. And in a situation where you do not you choose not to perform rescue breath, or you've considered the risk of COVID-19. In COVID-19, you are not expected to perform rescue breath. However, you should cover the face of the casualty of the victim with a piece of cloth, and you continue performing CPR. So the question is, wouldn't you suffocate the person? No, you cannot suffocate someone who is not breathing.
Okay.
So
True.
you keep performing chest compression to drive blood around the body, and particularly to get oxygen to the brain. If you have what is called automated external defibrillator, again, do we have automated external defibrillators in places? So automated external defibrillators, or AED, is a piece of equipment you use to restart the heart. It delivers controlled quantity of electricity to correct the abnormality, the electrical abnormality in the heart, with the aim of restarting the heart. So the common name sometimes is heart restart or heart restart machine, but the technical name is automated external defibrillator. So automated external defibrillator increases the likelihood of success in cardiopulmonary resuscitation. Cardiopulmonary resuscitation, or CPR, is not absolute. So you can perform CPR and still not be able to resuscitate that person. But when you do, first aid is about giving that person the second chance. It's about improving the condition. It has the physical, the psychological benefit, even on the provider, also the onlookers. Even if the outcome is, in the end, this person was in cardiac arrest, you performed CPR, you couldn't resuscitate them, well, the person died. Families, friends, people around can appreciate the fact that there was an effort. And there's a way it helps to build bond in the society. It's about appreciating the value of life. And until we truly appreciate the value of life, we may not be able to see first aid as being very important. Beyond sudden cardiac arrest, there's fainting. There's a situation, you could have a situation where the body temperature is very high, which could also trigger all sorts of sudden illnesses. You have stroke, you have heart attack, you have epilepsy. What are you going to do? And this is what I tell people. It's a matter of time. You will be in a situation where first aid will be required. It's a matter of time. You would always find yourself, at some point in your life, you would find yourself in a situation where first aid is required. It could be that you are by the roadside and you witness a road traffic accident, which is something I've seen a few times. The last time that happened on the corridor road, and this is to people who also cross the highway. So first aid is not about just responding. First aid is also about preventing an accident. If you are crossing the highway, you are risking your life. And so this man was crossing the highway. He got knocked down by a vehicle. The vehicle didn't stop. And what I witnessed from the other side of the road, I particularly saw one man stretching his arm and praying. I saw that gesture. And when I saw that, I knew it was serious. Before, in Nigeria, we pray at the side of the highway, then that was serious. Yeah. And I got to the scene. There were quite a number of people, but no one was doing the right thing. And so I brought up my first aid kit, stopped the person's bleeding. And so for bleeding, what you need to do is get a piece of cloth, apply pressure on the injury, and tie it in place. However, when you are tying, you have to be very careful not to shut off blood flow to other parts of the body. Bleeding is very, very common. And so everyone should learn how to stop bleeding. If the wound is severe, there's no point washing the wound. Do not wash wound under water. Do not suck blood. Do not encourage kids to put their wound in their mouth and suck their blood. It will result into infection. And so those are some of these common things, issues of first aid cases we need to learn. Then, what about drowning? There was a time someone was having an event at the beach, and he asked if I could send them first aiders. So I did. And lo and behold, someone was drowning. And then a lady was drowning. Another young man dived into the water to rescue. And both of them will soon disappear. And they did. So one of the participants dived also into the water, but this time wasn't trying to do the rescue himself. So he swam to a boat and informed the people in the boat that, look, at that point, there's a situation where two persons are drowning or have drowned. And then when luckily they brought them out, the young man was still breathing, but the lady, it took some time, and at the time she was rescued, she had stopped breathing. Mm-hmm. And so the young lady I sent to the program was able to perform cardiopulmonary resuscitation. So for drowning, now the common practice is the person is rescued from the water, and then you find someone stamping the tummy or slamming the person's chest. In a training, I was told that you could even pick the person, invert the person, hold both legs, and then spin.
Wow.
And then the effect of vertigo, this dizziness will cause the person to start vomiting. No.
Wow.
That's dangerous for both the responder and the victim. So what do you need to do? Once someone has been rescued, in that case, I said two persons were drowning. One was breathing, the other wasn't breathing. So if someone is breathing after they have been rescued, all you need to do is protect them from cold, cover them up, put them on their side in what we call recovery position. So when you put them on their side, they are lying like in this form on the side. What that does is that there's no pressure acting on the chest, so the person can breathe. And then because their airway is open, they can still breathe, and their mouth is low. Once they start vomiting, in drowning, poisoning, there are cases where irritation will cause the person to throw up, or pressure in the stomach could cause the person to throw up. And when that starts, because they are lying on their side, the contents then flows to the ground. Unlike when they are lying on their back, sometimes you find a situation where someone is maybe intoxicated on alcohol. And if that is the case, if someone is lying on their back and they start vomiting, because they are unconscious, they can't control the flow of the vomiters. Then it goes over the face and suffocate them. That is called aspiration. So to prevent aspiration, you put them on the side. So once they start vomiting or water starts draining out from their stomach, it goes to the floor. You don't need to put pressure on their tummy. However, if they are not breathing, perform CPR. Put them on their back, open the airway, start compressing their chest 30 times, and ventilate. Ventilate is to do your mouth-to-mouth. Again, in light of COVID-19, you would not have to put your mouth, except if that person is someone, maybe a relative whom you've shared the same risk level with. So you've been living together, you've been breathing into each other's faces. That's not the time you want to take your COVID precaution. So you just do your ventilation. I also mentioned imbalanced body temperature. A situation where your body temperature could go up or could crash below the normal range. And the first aid is simple. If it's high, you bring it down. If it's low, you bring it up. But what we need to know is that the methods of bringing down or increasing the body temperature, it must not be drastic. For instance, if a child is feverish, you need to tap a sponge. Okay, get a bowl of cold water, soak your towel in it, and then just pan the body, the face, the head to cool the body. So it doesn't have to be drastic. You don't bring the child in the room and turn on the AC and then the fan. No, that would not work. So first aid is about doing this very simple and basic thing. What about if the body temperature is low and you want to bring it up? All you have to do is cover the person up. Do not take a victim close to the fireplace or a direct source of heat. So what I'm saying here is, you've rescued someone from water, they are feeling cold. Do not take them directly to the fire. Just keep them warm in a dry place. To turn off the AC, keep them warm. Yeah, but you should still open the windows for cross ventilation, except if the environment is cold, and then that would defeat the purpose. One other common condition is stroke. Now there's the common knowledge that stroke is partial paralysis. No, that is not what stroke is. That could be the manifestation of stroke. Stroke happens in the brain. A situation where brain cells are affected, maybe as a result of lack of oxygen or spontaneous rupture of blood vessel in the brain. And when that happens, how do you even diagnose? So one thing in first aid is finding out what the problem is. Okay. If you cannot identify the problem, you can't provide the solution. And that's why people in this country, in Nigeria, and some part of the world, people come around and give different suggestions, do this, do that. Someone is not responding, someone is tapping the chest, another person is, opening the mouth, try another. So it's because you don't even know what the problem is. So to identify what stroke is, look at the face. Is there congestion? Is there loss of facial tone? A situation where maybe the person's jaw dropped to one side because they've lost muscle control. That's the reason. And then there's this flush face. You find the person's face congested. There's drooling. That's face. That's F. Then the next one is A, arm. Ask them to raise both arms. So in some situation, you find that the person might be able to raise one hand and the other won't be, or sometimes both. So it depends on the effect and then the extent of damage in the brain. And then ask them to make speech. What is your name? What is wrong with you? Even if you know the person's name. Oh, Mama, what is wrong with you? Hello, sir. What's wrong? Can you explain? So you want them to speak. You want to get the condition of their speech. The speech would, in the case of stroke, there will be slurred speech. There's no cohesion. And once you get to that point, that is the time for you to get medical help. There's not much you can do. There's no point making green tea or mopping them with hot water. Seek urgent medical attention because you have a golden period when it comes to the management of stroke. So do not waste that time. The earlier you seek help, the better.
Okay. Thank you very much, Mr. Dari, for that beautiful presentation, if I could call it that. But I like the fact that we had a lot of knowledge sharing. And one thing that caught my attention, some of the things that caught my attention while you were talking, is the fact that you said, okay, in real life situations, there's usually this feeling of helplessness when someone around you is having maybe choking, someone around you is choking, someone around you is convulsing all of a sudden, and a lot of people are around, they don't know what to do, there's the chaos that comes with it. Even as a trained first aider, how do you navigate through all this chaos to administer first aid on the casualty? And what I would like to also know, the challenges you have faced as a trained first aider, and what are the precautions you would expect from people, from first aiders to...
Good question. I like the question because it establishes the fact that even the responder is human and could also be under pressure, could feel a bit anxious. But it is, and that comes with expectations. But however, because of your knowledge base, knowledge builds confidence. Your approach to the scene. I've been to the worst scene in the most remote environment. And the fact that you're able to exude confidence, the way you approach, the way you talk to people in a public place to say, oh, please do not touch that person. Oh, no, don't drag them. And because also I go around with basic kits, the ones they see that I'm putting on gloves, or they are able to, identify that this person is here to help, and then they follow instructions. You can't do everything on your by yourself. I've been to a situation where I had area boys in coats, louds around, and I gave instruction to someone. Although in the end, I didn't like his approach because he used a bit of violence, but I needed him to help me disperse crowd, and it worked. And so you can't do everything yourself. You should be able to identify the resources around you and do that. Again, it's a function of training, of experience, of trying to do the same thing all over again. The dangers here, when it comes to first aid, is you could have a situation where you have security issues. You have to assess your security. In some place, honestly, I've been to a scene where I couldn't do anything because I couldn't just assess that this is the security level and I'm safe. You just have to be able to do that. Then there is the biological hazard. Once there's an accident, there's body fluid, there's blood, there's this. You have to protect yourself. You have to use your gloves. You have to wear your mask. In a pandemic, you can't even negotiate that. So those are some of the things I've been able to do. But again, training, drills. I participate in drills. You keep doing the same thing all over again.
Okay, so it's important. Okay, before we go, one more thing now. You were talking about moving around with basic kits. Briefly, just let us know what are the basic first aid kits. What are the basic things we should have in our homes, in our cars, in our workplaces, as far as first aid is concerned, that will help us to, administer first aid or help casualties when we see one.
Disposable gloves, triangular bandages, crepe bandages or roller bandages, adhesive tapes or what you call plasters, cotton wool, antiseptic wipes, soap wipes, alcohol wipes, and I have to say this. A common practice is to use methylated spirit on wound. It's a wrong practice. Do not use methylated spirit on wounds. You can clean with an antiseptic solution or just use your antiseptic wipes. So you need those 3 wipes: antiseptic wipes, soap wipes, alcohol wipes, cotton wool, plasters, bandages, crepe bandages, gauze pads, but do not forget your gloves.
Okay. Thank you very much, Mr. Dare. I have a whole lot jotted here that if I were to, continue asking questions and training my comments and all of that, we might be here for the next 30 minutes to 1 hour. So with this, we are going to wrap it up here, and I'm going to leave us with one important thing that I took away from this presentation is the fact that knowledge is very important when you're administering first aid. Never attempt to rescue a person if you are not knowledgeable enough to do so. You might actually be doing more harm than good. Thank you, Mr. Dare, for honoring our invite and being here today. I really appreciate your presence. Thank you very much.
Thank you for having me.
You're welcome.